Hello and welcome to Outcomes from a COPD Educational Program. This is part of our 2-minute EBP challenge at Ed for Nurses. If you'd like to find out more about it, you can go to edfornurses.com and sign up for your own 2-minute EBP challenge. You get it right in your email every Friday. Get the answer in your email on Monday. Well, welcome. My name is David Woodruff, and I'm the president of Ed for Nurses, where we empower nurses to become extraordinary. You can follow our blog by going to facebook.com/Ed for Nurses, or just go to your Facebook account and search for Ed for Nurses. What we're talking about today is an educational program. Now, usually educational programs, for example, with diabetes and arthritis, educational programs work well to decrease the amount of hospitalizations, the amount of medications that people need to take, and mortality. So they seem to be very helpful in certain kinds of conditions. However, there was a little bit of a change that we saw here with patients who had COPD and an educational program. So what we found with other types of educational programs is, of course, a decrease in hospital admissions, decreased morbidity, so, they're not having as many other kinds of complications of their disease process, a decrease in the amount of medication that the patient has to take, and a decrease in mortality. Now, let's just talk a little bit about COPD first, and then we'll talk about the results of this particular study. The characteristics of COPD are, this is a disease that affects the distal airways and the alveoli. So it's affecting way out there. It's not affecting these big airways so much as the little airways, the distal airways, the terminal bronchi, and the alveoli. That's where the disease is occurring. We have destruction of those distal airways and alveoli, and we have mucus production. So there's two different processes that are going on. Now, maybe you've heard before about COPDers being kind of lumped into these categories of blue bloaters and pink puffers. Well, most patients who have COPD have both disease processes. They have both emphysema, that's the destruction of the airways and the tissues, and they also have chronic bronchitis, that's the mucus production. So most of our COPDers have both of these disease processes occurring at the same time, not one or the other. So it's unlikely that you're going to find somebody that really fits the mold of a blue bloater or a pink puffer, because in most cases, our patients have a combination of both diseases. So anticipate that you're going to see both things. And what we're seeing in this x-ray here is we're seeing some very hyper-expanded lungs. Now, because of the destruction of the terminal airways and because of that mucus production and the mucus blocking the airways, we're going to get air trapping in those small airways and the alveoli way out there, and it makes these hyper-expanded lungs. Now, look how the lung is like fully expanded all the way out to the chest wall. The lungs almost look square. They look like they're big rectangles instead of having kind of a rounded look to them. And that is very typical of COPD. The lungs come up higher in the chest than they should, up above the clavicle. They're coming down lower than they should, rather than having a nice diaphragmatic curve on the bottom. Instead, what we have is kind of a flattened out diaphragm from these hyper-expanded lungs. In addition, also, look at that heart. Notice in this x-ray how narrow that heart is. And that heart is narrow because we have so much air trapping going on. It's squeezing the mediastinum, squeezing the heart, and that's why many of your COPDers will also have heart failure. So if you're looking at a patient who has COPD, look for the heart failure, look for the cardiac dysfunction, because those two things go hand in hand. Now, because of the destruction of the airways and the small alveoli, etc., and because of the mucus production, we're trapping air in the lungs, and that is going to cause CO2 retention. So you could anticipate that your COPDer is going to start retaining CO2. Now, in this particular case, what they did, the intervention was they did 4 weeks of educational programs. So they had 90-minute educational programs. The COPDers would come in and they would sit for their 90-minute educational program. They had an action plan in place. This was their action plan of what they're supposed to do with their illness to try to keep it at bay and to keep from having exacerbations, etc. So they had all that stuff in place. And then they had calls on a regular basis, so scheduled calls from a case manager. So this was the intervention. Now, normally, I would think that, boy, an intervention like this would be fantastic. It would probably decrease the amount of medications that our patients are taking, decrease the amount of hospitalizations, decrease their mortality, their morbidity, etc. But what happened in this case? There was no decrease in hospitalizations, and there was actually an increase in mortality. Now, the authors have no particular explanation for why this happened the way it did. However, maybe it was that because they were getting more information, they felt better, or they felt more like they could manage the disease on their own and they didn't need health care. We don't know. We don't know what the situation was. We don't know why the intervention didn't work. But this certainly gives us some more information about the fact that we really need to investigate these things. This sounds like a great idea to me, but in this case here, it actually didn't work, and they had to stop the study early for futility. In other words, it wasn't achieving what they wanted it to achieve, and in fact, it was actually increasing mortality. So they had to go back to the standard method. Now, the standard method was just simply having the patient follow up with their physician. So maybe it is the follow-up with physicians that makes a difference. Rather than having these educational sessions and the calls from the case manager, maybe it's that physician seeing the patient and finding problems early. Maybe that's the thing that really helps in COPD. We don't really know from the study. All we know is that the educational program that they put in place was not effective in decreasing mortality in this patient population. One other thing, though, that has been shown to decrease mortality in COPD is pulmonary rehabilitation. So think about the possibility of pulmonary rehab for your patients who have COPD. So he's calling the patient and says, the spot wasn't on your lung, it was on the x-ray. Barbecue sauce. Please stand by for an apology and a great explanation from my nurse. Okay, well, hopefully the spots on the lung are not going to be from barbecue sauce. And in fact, we're only going to see what really is there. If you'd like to find out more about this study, you can find it in the Annuals in Internal Medicine. And this is by Dr. Fan and colleagues, called A Comprehensive Care Management Program to Prevent Chronic Obstructive Pulmonary Disease Hospitalizations. Also, you can get nursing tips sent right to your cell phone by texting 86677. In the body of your text, write in nursing tips, all one word, and you will get nursing tips sent to your cell phone once a week. We don't spam you. We know that people pay for their texts, so you get one a week so that we're not going to have problems with you running into a big text bill. They come from us. They come from Ed for Nurses, so you know that we're not going to spam you or sell your email, your phone number or anything like that to anybody else. Well, thank you for joining me this week for Outcomes from a COPD educational program. Join us online by going to edfornurses.com. My name is David Woodruff, and until next time, bye now.